Good day, Miss. Good day, class. We are the ER group, and today the topic we will be discussing is near drowning. Our group members are Asha Francisco, Kadeen Marcel, and Ushinashi Dimba. The course objective we'll be covering today are defining drowning and near drowning, distinguishing between saltwater drowning and freshwater drowning, identifying the causes and risk factors associated with drowning, explaining the pathophysiology of a drowning victim, identify how to spot a near drowning victim, demonstrating the medical and nursing management of a near drowning victim, outlining the nursing's diagnosis of a near drowning victim or patient at the hospital, recognize when a victim or patient has poor prognosis or health status, and safety tips for when or in near drowning water. So drowning is the process of experiencing respiratory impairment from submersion or immersion in liquid. Not all drowning are fatal. Submersion is the entire body underwater, like in a river or the sea, or a pool, and immersion is when only the head of a person is under water, like when a baby falls into a bucket. Near drowning is a term typically used to describe almost dying from suffocating underwater. It is the last stage before fatal drowning, which results in death. Near drowning victims still require medical attention to prevent related health complications. Saltwater versus freshwater near drowning. Freshwater. Water enters a victim's lungs, which in nature is an alveoli surfactant. Surfactant is a compound that helps keep the surface tension between air and liquid. Water rapidly passes into the bloodstream, producing hemolysis, which is the red blood cells to swell and burst, causing a buildup of the sediments in the blood. The fluid filling the victim's lungs will prevent the body from taking in enough air, which leads to cardiac arrest. Freshwater drowning can take anywhere from 5 to 20 minutes, and victim is more than likely unconscious by the time the heart stops. Young children under 5 years are more likely to drown in freshwater. Saltwater drowning. Water enters a victim's lungs and dilutes the alveoli surfactants. This is because saltwater has a greater salt concentration, so water moves from within the person's blood vessels to outside of it. The saltwater fills the lungs, and the circulating blood plasma is drawn out via osmosis into the alveoli, resulting in hemoconcentration and increased blood electrolyte levels. So because the water is drawn out of the person's blood vessels, there is a stronger concentration of blood, which is hemoconcentration and the increased blood electrolyte levels. This liquid builds up in the air sacs, stops oxygen from reaching the blood. So the victim technically drowns in their own fluid. The body is unable to acquire sufficient oxygen, which leads to cardiac arrest. Saltwater drowning can take anywhere from 5 to 30 minutes. Older children and adults are more susceptible to drowning in salt water. Some causes and risk factors. The majority of near drowning cases are attributed to accidents that occur near or in the water. The most common cause of near drowning include an inability to swim, panic in the water, leaving children unattended near bodies of water, leaving babies unattended even for a short period of time in bathtubs, falling through thin ice, alcohol consumption while swimming or in a boat, concussion, seizures, or heart attack which happen while in the water, risky behaviors like jumping off a cliff, and suicide attempts. pathophysiology. So there are 4 stages of drowning. The first stage is voluntary breath holding until the urge to breathe becomes overwhelming. Second stage, fluid aspirated into the airways. Third stage, cerebral anoxia. And the fourth stage, cerebral injury. Loss of normal breathing pattern and panic. So usually when a person realizes they're drowning, they begin to panic and usually begin to breathe faster. And the thing that they will look to do is hold their breath. This breath holding happens until they can no longer hold their breath and they become air hungry. When the resistance to hold their breath is no longer available, they take in a breath, but instead of taking in air, they take in water, so they aspirate. This aspiration of fluid going into the lungs causes a reflex mechanism to kick in, which is a laryngospasm reflex, which is where the larynx closes itself up to prevent more fluid from going into the lungs, which then leads to hypoxia, preventing the patient to even possibly take in any air if they could, or even yell for help. Some pulmonary, this leads to pulmonary edema or hemodilation. Pulmonary edema happens in salt water and hemodilation happens in fresh water. So some pulmonary effects are the washout of surfactants, which leads to atelectasis, then to a VQ mismatch or shunting. This is usually when the alveoli is no longer able to pass oxygen into the blood vessels, so shunting occurs, which leads to hypoxemia from the decreased oxygen and in the blood vessels. When auscultating, you usually hear wheezing and crackles. Some neurological effects: hypoxemia, which leads to ischemia, then leads to neuron damage. So, and then cerebral edema, which leads to increased ICP. Some victims who end up unconscious and then is able to be saved usually have memory issues and motor issues after regaining consciousness. Some CVS effects, usually arrhythmias happen, which will be tachycardia or brachycardia, and they affect the atrium, which leads to atrial fibrillation. Renal effects, ATN due to hypoxemia, which is the death of the tissue in the kidneys, which leads to kidney dysfunction. This is a diagram annotating what usually occurs in different parts of the body when within a drowning victim. Now we'll have some videos that could help further explain the topic.
Swimming is always a summer favorite for fun and cooling down. But if you don't know how to swim or get caught, a carefree day can turn bad very quickly if you're not careful. But what does drowning actually feel like? Is it a quiet, peaceful experience like in the movies? Or are you panicking the whole time like in a video game when your breath meter is ticking down? When we see someone who can't swim in the movies, it's usually a very misleading version of what really happens. In fiction, it's usually depicted as someone screaming, waving their arms, and splashing around to show they can't swim. But in real life, drowning is almost silent. If you can scream, you can breathe. And if you can breathe, you're not drowning. Drowning is directly related to our breathing. It all begins when a person isn't able to keep their head and mouth above water. To the untrained eye, the person may not even look like they're in distress. People may begin to drown for a variety of reasons. They could be caught in a riptide in the ocean where the current drags them under. Or it may be that the water is calm, but they don't know how to swim or float. Once a person can't keep their mouth above the water, the 4 steps of drowning start. First, the person holds their breath voluntarily until the urge to breathe becomes totally overwhelming. At this point, a person holds their breath automatically, but at a certain point, a reflexive response forces the person to inhale, which leads us to the second step. Water gets aspirated or breathed into the airways or gets swallowed. The third step, called cerebral anoxia, happens when the body detects water in the lungs and stops the breathing system completely. This happens because water enters the trachea and causes a spasm that seals the airways so that no more water can come in. This is the body's way of protecting itself. And finally, the fourth step, since no oxygen is reaching the brain, cerebral injury sets in and can be irreversible. The water that does reach your lungs can make red blood cells in your lungs burst and lead to massive organ failure. If the water you aspirate is salt water, it can mix with the burst red blood cells, causing your lungs to fill up with a type of plasma. Either way, it's a bad deal that feels like searing pain in your chest. Eventually, the person drowning will lose consciousness, and the next step is permanent unconsciousness. However, drowning does not necessarily lead to death if the person is saved in time, but it has to be quickly, and the water has to be immediately extracted from a body with life-saving techniques. If a person does survive drowning, they could suffer lifelong consequences, like major brain damage, acute lung injury, or pneumonia, depending on how long they were underwater and if not treated properly. The best way to avoid drowning is by knowing the proper swimming techniques and staying out of the water when it's dangerous. Certified swimming instructors have classes year-round and teach all ages. Even babies at 6 months have been taught to float. So if you can't swim and are physically able to, then there's no excuse not to learn. But whether you want to learn or not, you can also take classes to learn life-saving techniques like CPR and how to extract water from a person once you get them out of the water. Every single year, an estimated 4.5 million people die from drowning. So you never know when you might be in the position to save someone's life yourself. Thanks for watching. And if you really want to make Fuzzy happy, hit that subscribe button. And be sure to turn on notifications. They drive nuts crazy. See you next time.
Hey there, welcome to Life Noggin. Every year, there are over 370,000 drowning deaths worldwide, with children under 5 being the most at risk. And with all the drowning deaths you see in movies and TV, it's no wonder that people are afraid of dying that way. But what's actually going on during that process? Well, firstly, drowning isn't like how you see it in the movies. There's not a lot of thrashing around or yells for help. Typically, it's a silent act, where the person's mouth sinks below the surface of the water and then reappears as they try to breathe. Once they can no longer hold their initial breath and start to hyperventilate, they might aspirate water, triggering something called a laryngospasm. This is where the person's vocal cords spasm, blocking their airways and protecting their lungs. However, it also inconveniently makes yelling for help significantly harder to do. Since the person can't take in any fresh air, their oxygen supply starts to fall, potentially leading to a condition called hypoxia. This is where there's not enough oxygen reaching the body's tissues, and eventually, as the person becomes unconscious, there's a relaxation of their airway, allowing their lungs to fill with water. Depending on how long the person is gone without air, varying levels of damage can occur. For example, a 2013 study found that the likelihood of surviving with little to no brain damage was very low after being submerged for 10 minutes or more. The lack of oxygen can also lead to cardiac arrest. So basically what I'm saying is that drowning is absolutely terrifying, so please wear your life jackets, kids. They're cool, and they'll keep you safe. I know I look fantastic in my floaties. On top of all of that, if the person is in really cold water, there's also the fear of hypothermia, where the core body temperature falls below 35 degrees Celsius. When hypothermia sets in, it'll cause the body to start shivering intensely, and the person might act clumsy or confused. Their bodies slow down, including their respiration, heart, and metabolic rates, and eventually they might lose consciousness and even die. Let's all take a moment to mourn the loss of Jack from Titanic. But come on, there was seriously enough room on that door for him too. While hypothermia is a serious threat, it may actually help to prevent the effects of hypoxia. See, it can trigger the diving reflex, where blood vessels constrict and the heart rate slows, and the blood is diverted to the parts of the body that need it the most, like the brain. Hypothermia also decreases how much oxygen is needed by the body's tissues, meaning that it can actually prolong survival and help prevent the tissue damage from hypoxia. In fact, hypothermia and the diving reflex is often cited as a big reason why some young children have been able to survive drowning after being under the water for far more than 10 minutes. That being said, do not try to replicate that yourself. It's definitely best to stick with those huge inflatable pool toys instead. I call dibs on the flamingo. Are you afraid of the water? What life-threatening situation do you want us to talk about next? This episode was a little bit morbid, so why don't we celebrate the fact that you exist? If you want to know the odds of you this video. See, in most cases, in order for you to be alive,
Spotting a victim. Notify a lifeguard if one is close. If not, ask someone to contact emergency responders. If alone, find a sturdy object or flotation device that the victim can hold on to. Do not attempt to rescue by going into the water, if not trained to do so.
Right, so the medical and nursing management of a near drowning patient. Advanced pre-hospital care. Advanced care can be performed by trained personnel such as lifeguards and emergency medical technicians, otherwise known as EMTs. This is done simultaneously. So you will have secure airway, followed by improved oxygenation, stabilized circulation, gastric decompression, and thermal insulation. Initial care, before you meet to the hospital, you would have CPR and ventilation, supplemental O2, and intubation of the patient, right? In doing so, you would want to place the patient in a supine position on a stretcher so that the head and feet are at the same level. You want to use the head tilt, chin lift technique, or a cervical collar for spinal alignment. You want to maintain airway and attempt resuscitation unless clear signs of death. You want to also commence the CPR. If the patient is unconscious and breathing, you would place the patient in a lateral recumbent position, as vomiting is common and can lead to aspiration. If a patient is unconscious and not breathing, you should give 2 to 5 rescue breaths, followed by 30 compressions and 2 breaths. Now, during the rescue breaths, most patients or victims, I should say, tend to vomit within the 2 breaths period. So you definitely want to ensure that you put them in a position where they could vomit and not be able to aspirate the vomit that they are giving out. You want to ventilate the patient as soon as possible with tools such as oxygen and a bag valve mask. If no response, assume cardiac arrest. You want to also continue CPR with 30 compressions, 2 breaths. Consider intubation, mechanical ventilation, positive end expiratory pressure, also known as PEEP, or by level positive airway pressure. Administer 100% O2 at 15 liters as soon as possible and until discontinued by the medical officer, which would be at the hospital. Some cardiac interventions. Most common dysrhythmias are asystole and pulseless electrical activity. Antiarrhythmetics should be withheld for core temperatures of less than 30 degrees Celsius, so 86 degrees Fahrenheit, with emphasis placed on chest compressions and ventilation to maintain perfusion. You want to manage arrhythmias by the protocols of your hospital or the institution that you're working under. Consider gastric decompression, as many drowning patients swallow water prior to inhaling, and between 60 and 80% will vomit at some point during recovery or resuscitation, as per the 2 breaths, rescue breaths. You want to keep the victim warm. IV fluids, you want to obtain access and place the Foley where appropriate to monitor. You want to assess patient history and physical, vital signs, and determine Glasgow Coma scale. Lung injury may take up to 6 hours to present and may not be immediately present. You want to monitor for wet lung sounds, productive cough, rapid shallow breaths, substernal burning, irregular or slow heart rate, and altered consciousness. When you're going to transport them, you want to evacuate the victim that requires resuscitation or who was unresponsive in the water or has dyspnea or other respiratory symptoms. So at the hospital, in the emergency room, you wanna use the ABCDE to help assess the patient. So A, as per airway, you wanna intubate, especially if neurologic symptoms appear, right? You wanna do ABGs for partial oxygen that is less than 60 or carbon dioxide that is more than 50. B, which is breathing, you want to give supplemental O2, maintain O2 above 94%, and keep them on a CPAP machine. C, which is circulation, you want to monitor the BP, pulse, the cardiac telemetry, oxygen saturation, and end-tidal carbon dioxide. D, disability, you want to monitor for neurological problems. You want to check the Glasgow Coma scale, elevate the head as to decrease intracranial pressure, or you could give diuretics. Seizure and non-sedative anticonvulsives. E, you want to monitor for hypothermia, which could lead to vasoconstriction, diuresis, hypovolemia, and hypotension. So you want to manage all of those before it happens. Right? When you're accessing your mental status, you're using the Glasgow Coma scale, you want to ensure that the scale is above 13. Clear cervical spine, you want to monitor O2 saturations and observe for 4 to 6 hours. You want to give supplemental O2 to keep saturation above 95%. As I said before, you want to do that using a non-rebreathable mask at 15 liters per minute. Continuous positive airway pressure. You want to intubate and ventilate with low tidal volume at 6 milliliters per kilogram. Low PEEP, 5 to 10 centimeters H2O. High PEEP may impair venous return, resulting in hypertension, and volume ventilation at 10 liters per minute. You want to administer inhaled albuterol and nebulized ipratropium for spasms. That is another name for Atrovent in the hospital. Maintain glucose between 80 and 140 for ventilated patients. Perform tests on patients such as chest X-ray, EKGs, labs, total blood counts. You want to monitor for sepsis and CT head and neck. You want to also monitor for acid-base status with arterial blood gas, alveolar ventilation, acceptable PCO2 and pH. Gas exchange, perfusion, temperature, usually done rectally, volume, which is BP, urine output, central venous pressure, initial resuscitation with crystalloids, And you also want to monitor for signs of infection. Moving on to the nursing diagnosis.
Nursing diagnosis for drowning conditions. Impaired gas exchange related to aspiration, evidenced by abnormal arterial blood gases. Ineffective cerebral tissue perfusion related to pulmonary capillary membrane, or damage evident by hypoxemia or hypoxia. Risk for infection related to pulmonary surfactant elimination and fruity pink tinge spotting. Risk for decreased cardiac output evident by abnormal breathing rate, depth, and reading. Excess fluid volume related to pulmonary edema evident by pulmonary surfactant elimination. Okay, health status prognosis factor. So we could have poor prognosis, submersion greater than 25 minutes, resuscitation greater than 25 minutes, age greater than 14, GCS less than 5, apnea, and pH less than 7.1. Safety tips: never swim alone. Supervise children when they are in water. Don't play holding game. Don't play breath holding games. Always wear life vest or floating device. Never jump into water to save a friend. Always enter the water feet first. Stay away from pool drains. Stay within designated swim areas. Avoid alcohol consumption. Learn CPR and teach kids to be safe in water. So this brings us to the end of our presentation.